Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 2. Preparedness and Response on Emergency. Emergency assessment. A systematic approach to the assessment of an emergency patient is essential. Usually, the most dramatic injury is not the most serious. The primary and secondary assessments provide the emergency nurse with a methodical approach to help identify and prioritize patient needs. We will utilize the primary and secondary assessment. Primary assessment. The initial, rapid, ABCD, airway, breathing, and circulation, as well as neurologic disability resulting from the spinal cord or head injuries. Assessment of the patient is meant to identify life-threatening problems. If conditions are identified that present an immediate threat to life, appropriate interventions are required before proceeding to the secondary assessment. Under primary assessment we will be using the mnemonics A, B, C, and D. A for airway. Does the patient have an open airway? Is the patient able to speak? Check for airway obstructions such as loose teeth, foreign objects, bleeding, vomitus, or other secretions. Immediately treat anything that compromises the airway. B for breathing. Is the patient breathing? Assess for equal rise and fall of the chest. Check for bilateral breath sounds, respiratory rate and pattern, skin color, use of accessory muscles, adventitious breath sounds, the integrity of the chest wall, and position of the trachea. All major trauma patients require supplemental oxygen via a non-rebreather mask. C for circulation. Is circulation in immediate jeopardy? Can you palpate a central pulse? What is the quality? Strong, weak, slow, rapid? Is the skin warm and dry? Is the skin color normal? Obtain a blood pressure, BP, in both arms, if chest trauma or dissecting aortic aneurysm is suspected. Can you see obvious bleeding? Or check the capillary refill. And lastly, D for disability. Assess level of consciousness and pupils. A more complete neurologic assessment will be completed in the secondary assessment. Assess level of consciousness using the ABPU scale. A. Is the patient alert? V. Does the patient respond to voice? P. Does the patient respond to painful stimulus? U. The patient is unresponsive even to painful stimulus. Next is secondary assessment. The secondary assessment is a brief but thorough systematic assessment designed to identify all injuries. The steps include expose/environmental control, full set of vital signs/5 interventions/ facilitate family presence and give comfort measures, history taking, head to toe assessment and inspection of posterior surface. E for expose/environmental control. It is necessary to remove the patient's clothing in order to identify all injuries. You must then prevent heat loss by using warm blankets, overhead warmers, and warmed IV fluids, unless induced hypothermia is indicated. F for full set of vital signs. Obtain a full set of vital signs including BP, heart rate, respiratory rate, and temperature. As stated previously, obtain BP in both arms if chest trauma or dissecting aortic aneurysm is suspected. Institute continuous cardiac monitoring. Assess Glasgow Coma Scale, GCS, and pain score. Another F. 5 interventions. Vascular access. Pulse oximetry to measure the oxygen saturation. Consider capnography to measure end-tidal carbon dioxide, non-invasive ultrasonic cardiac output monitor, and electrocardiogram. Indwelling urinary catheter. Take note of this one. Do not insert if you note blood at the meatus, blood in the scrotum, or if you suspect a pelvic fracture. Gastric tube. If there is evidence of facial fractures, insert the tube orally rather than nasally. Laboratory studies frequently include type and cross-matching, complete blood count, CBC, urine drug screen, blood alcohol, electrolytes, prothrombin time, PT, and partial thromboplastin time, PTT, arterial blood gas, ABG, and pregnancy test if applicable. Last F is to facilitate family presence. It is important to assess the family's needs. If any member of the family wishes to be present during the resuscitation, it is imperative to assign a staff member to that person to explain what is being done and offer support. G4 Give comfort measures. These include verbal reassurances as well as pain management as appropriate. Do not forget to give comfort measures to the family during the resuscitation process. After doing all these things, we can now proceed to history taking and head-to-toe assessment. History taking. 1. Obtain pre-hospital information from emergency personnel, patient, family, or bystanders using the mnemonic MIVT. M for mechanism of injury. It is helpful to understand the mechanism of injury to anticipate probable injuries. It is particularly helpful in motor vehicle accidents to know such information as external and internal damage to the car and the period of time elapsed before the patient received medical attention. I for injuries sustained or suspected. Ask pre-hospital personnel to list any injuries that they have identified. V for vital signs. What were the pre-hospital vital signs? And lastly, T for treatment. What treatment did the patient receive before arriving at the hospital, and what was patient's response to those interventions? 2. If the patient is conscious, it is essential to ask him what happened. How did the accident occur? Why did it happen? A fall, for example, may not be a simple fall. Perhaps the patient blacked out and then fell. If the patient is conscious and time permits, explore the chief complaint through the PQRST mnemonic. P. Provokes, palliates, precipitates. Q. Quality. R. Region, radiates. S. Severity, associated symptoms. T. Timing, onset, duration. 3. Obtain past medical history from the patient or a family member or friend, including age, medical/surgical history, current medications, use of any illicit drugs, allergies, last menstrual period, last meal, and last tetanus shot. We can explore this assessment using the mnemonic SAMPLE. S. Signs and symptoms. A. Allergies. M. Medications. P. Past medical history. L. Last meal. And the events surrounding the injury. Take note. To obtain a good descriptive history, do not ask questions that can be answered with a yes or no. Head-to-toe assessment. The head-to-toe assessment begins with assessment of the patient's general appearance, including body position or any guarding or posturing. Work from the head down, systematically assessing the patient one body area at a time. 1. Head and face. Inspect for any lacerations, abrasions, contusions, avulsions, puncture wounds, impaled objects, ecchymosis, or edema. Palpate for crepitus, crackling, or bony deformities. 2. Chest. Inspect for breathing effectiveness, paradoxical chest wall movement, disruptions in chest wall integrity. Auscultate for bilateral breath sounds and adventitious breath sounds. Palpate for bony crepitus or deformities. 3. Abdomen/flanks. Inspect for lacerations, abrasions, contusions, avulsions, puncture wounds, impaled objects, ecchymosis, edema, scars, eviscerations, or distension. Auscultate for the presence of bowel sounds. Palpate for rigidity, guarding, masses, or areas of tenderness. 4. Pelvis/perineum. Inspect for lacerations, abrasions, contusions, avulsions, puncture wounds, impaled objects, ecchymosis, edema, or scars. Look for blood at the urinary meatus. Look for priapism, which could indicate spinal cord injury. Palpate for pelvic instability and anal sphincter tone. 5. Extremities. Inspect skin color and temperature. Look for signs of injury and bleeding. Does the patient have movement and sensation of all extremities? Palpate peripheral pulses, any bony crepitus, or areas of tenderness. 6. Posterior surfaces. Utilizing help, log roll the patient in order to inspect for possible injuries. Palpate the vertebral column and all areas for tenderness. We can explore this assessment using the mnemonic DCAP, BTLS. D. Deformity. C. Contusion. A. Abrasion. P. Puncture. B. Burn. T. Tenderness. L. Laceration. S. Swelling. Focused assessment. Any injuries that were identified during the primary and secondary surveys require a detailed assessment, which will typically include a team approach and radiographic studies. Thank you for listening. Have a good day and be safe. Agyamanag.